Hey, aloha mai kako. Welcome to the Kale Mao Center for Sustainable Island Food Systems 5th Brown Bag Speaker Series event. I'm Ioane, and on behalf of the center, I want to mahalo all of our guests and presenters for taking the time to attend today. We have a QR code at the bottom left corner of the current slide, so you can see previous events that we've hosted through one of our partners' web pages, Transforming Hawaii's Food System Together. And please stay tuned for the recording of this event, which will be posted and sent out to all registered guests within a few days. And don't worry if you can't scan the QR code in time, because I'll be posting links to access that page along with all of our panelists' relevant content during today's webinar event. This speaker series is one of the projects we're working on at the Ke'o Mau Center for Sustainable Island Food Systems, which is an initiative within the University of Hawaii system, co-directed by both Dr. Albie Miles and Dr. Noah Lincoln. A little bit about our name, Ke'o Mau. It's a term that we're using to describe the idea of food sustainability. And O is being used as a word for food provisions that were prepared and taken on long journeys aboard Ba'a. And Mau is a word used to emphasize and convey something that's long-lasting, steady, and constant. These were the food supplies that sustained voyagers on their long treks across the Pacific Ocean. And today, similarly, we see ourselves being on this sort of long transformative journey to improve our food system. One of our major goals here is to collaborate with folks at UH and across the entire food systems landscape in Hawaii to highlight the work being done by organizations to improve our local food system. This includes addressing topics such as food security, justice and equity within the food system, ecological sustainability, and food system policy, just to name a few. Oftentimes we see that this work is isolated, being conducted in silos. So we're here trying to make connections by building and maintaining important relationships, sharing the work being done by these organizations with people who it's significantly affecting. Overall, we want to better identify what the university can do to support food systems transformation in Hawaii. And in addition to hosting events such as this, the Ke'o Mau Center has been established to engage in a number of activities, including research, data collection, education, community engagement, policy analysis, and other monitoring activities seen here in this slide. The intention here is to really create and maintain the social, intellectual, economic, and political spaces that we feel are necessary in order to drive systemic change in a forward direction for the food system in Hawaii to measure and realize food sustainability goals better. Many of these materials will be available in the near future as we continue to stand up the organization and build out our website. So please be on the lookout in your email inboxes as we continue to grow and share resources and materials. So without further delay, I would like to introduce our guests. Today, we're joined by 4 different guests on the topic of food insecurity. Dr. Catherine Pirkle, owner of Pirkle Epidemiology and Evaluation Consulting, LLC. Amy Miller, President and CEO of Hawaii Food Bank. We have Jason Shon, Food Security and Sustainability Manager for the City and County of Honolulu, and Alex Narrajos-Corby, Sustainable Agriculture and Food Systems Program Manager for the City and County of Honolulu. Today's show is going to run a little bit differently than some of our past events. We're going to begin with Catherine sharing a little bit, reviewing the state of food insecurity in Hawaii study. And then Amy will discuss her role at the Hawaii Food Bank, what is being observed within the community, and how it relates to the data, as well as an overview of current programs and initiatives at the Hawaii Food Bank. Following that, we're going to have Jason and Alex provide some background and discuss their roles and responsibilities at the City and County of Honolulu, and talk about how they're working to address food insecurity issues and the future of food systems planning in response to this recent study, as well as other food systems issues in Hawaii. So a few housekeeping items for today. All audience interaction is limited to the Q&A feature within the Zoom platform, and any questions not addressed within the allotted time can be answered via email from our panelist guests following the event's conclusion. So now, without further delay, I'll hand it over to Catherine. Catherine, please take it away.
Thank you. Amy, I'm going to ask you to thank you. Aloha, everyone. I want to express my sincere thank you for inviting me to be here, and mahalo for those who are here listening in the audience. I have had the sincere pleasure of collaborating with the Hawaii Food Bank on a project that I feel is really important in the state, and that is to systematically assess the state of food insecurity in Hawaii. Next slide, please. So before we start, I want to make sure that we are all on the same page as to what do we mean by food insecurity. The definition that you see here comes from the United States Department of Agriculture. And according to this definition, food insecurity is the lack of access to enough food for an active and healthy life. It manifests in different ways, ranging from concerns about running out of food before there is money to buy more, to the inability to afford a balanced diet, reducing food intake, missing meals altogether, and in extreme cases, not eating for whole days because of a lack of food and money. Food insecurity exists on a spectrum. It goes from anxiety about having enough food and being able to pay for food to the most extreme case, which is going whole days without food. Next slide. So I want to give you a little background about the survey that we did. The survey was administered by SMS Research, and I did the analysis on the results. I worked very closely with the Hawaii Food Bank in order to design a survey questionnaire that would allow us to assess the state of food insecurity in Hawaii. So what we did is we administered the survey statewide to 910 adult Hawaii residents. And to assess food insecurity, we used a measurement tool that's called the United States Household Food Security Survey Module. This specific tool is considered the most validated measurement instrument for assessing household food security in a population. So when I say a validated measurement instrument, what I mean is that it's been scientifically tested for its measurement properties. Does it measure what we think it's supposed to measure, and can it do it reliably? In addition to assessing the state of food security in the state, and we did this for the year 2023, we also measured other characteristics like the respondents' demographics, things like age, sex, race, ethnicity, their health status and medication usage. We measured other things like their knowledge and use of food bank services, and their methods, if they used other methods for obtaining food, as well as the ways in which they have been affected by the Maui wildfires. Next slide. So the main finding of this survey was that 1 in 3 Hawaii households experienced food insecurity in 2023. Of these, 11% were categorized as low food security, meaning that they had to make changes or compromise the types of foods or the nutritional quality of the foods that they were consuming. 19% were characterized as very low food security, meaning that they were actually skipping meals or going whole days without food. As you can see from these results, 10% of Hawaii households were going a whole day without food in some or most months in 2023. The other number I wanted to show you was that in 2023, 37% of all households felt anxious about running out of food, although not all of these households were food insecure. Next slide, please. Now, it would be easy to say that perhaps the results of our survey were an exception, that maybe it was just something to do with our sampling, or for whatever reason, the results were not representative of the state of the situation in Hawaii. But there have been other surveys conducted, and results are very similar to ours. So here what I'm showing you are a series of community pulse surveys that were conducted by SMS Research. For starting in 2020 and going into spring of 2022, they asked the question that you see here. The food that I or we bought just didn't last, and I or we didn't have money to get more. We also had this same question in our survey. And if you have to ask one question to assess food security in a population, this is the question to do it. It is considered valid. So what we can see if we use this question is that food insecurity was increasing between the summer of 2020, which was really at the beginning of the COVID-19 pandemic, and all the way until spring of 2022. The last two community pulse surveys that they did in November of 2021 and then in March and April of 2022, their numbers almost completely matched the numbers that we got. And critical to understand, each one of these surveys that they did was done in a separate sample of about 400 people. So our numbers are consistent with what others have been seeing as well. Next slide, please. So in addition to being able to assess food security statewide, we could also look at what food security looked like for those households that had children. So we could see what the level of food insecurity was for the households with children, but also specifically for the children themselves. Accordingly, 29% of households that had children or multiple children faced food insecurity in 2023. 9% of households that had children were skipping, 99% of households had children skipping meals because there was not enough money for food. And 6% of households with children had a child or children going a whole day without food because of a lack of money. Now, parents are oftentimes going to sacrifice in order to take care of their children. They might cut down their meals, change the nutritional quality of their meals in order for their children not to have to experience the same thing. So in households with children, the level of food insecurity amongst the adults in those households was 10% higher than for the children themselves. So food insecurity was 38% amongst households with children. Next slide, please. We were able to look at food insecurity by county. It was highest in Hawaiʻi Island at 40% and lowest in Kauai Island at 23%. All of these numbers, however, are quite high. Next slide. As I mentioned at the beginning of this presentation, we asked a lot of questions about people's demographic characteristics, and some of the results we have are presented here. Food insecurity was especially high amongst young adults ages 18 to 29. About 1 in 5 of respondents in that age group resided in 1 and 2 respondents in that age group resided in households that were experiencing food insecurity. We also saw that food insecurity was high amongst those enrolled in higher education and also quite high amongst those who identified as gay, lesbian, bisexual, or some other identity besides straight. Next slide, please. We examined food insecurity status by race ethnicity, and food insecurity was highest amongst Native Hawaiians, Pacific Islanders, Filipinos, and American Indian Alaska Natives. There were quite large disparities across race ethnicity in the state, with the lowest level of food insecurity amongst Japanese. The numbers by race ethnicity varied from 21% to 53%. Again, though, all of these numbers are high. Next slide, please. Another thing that we were able to do with this survey is look at household food insecurity by the health status or health characteristics reported by the survey respondent. Of those respondents who reported that their health was poor or very poor, 56% resided in food insecure households. We saw that 64% of food insecure respondents delayed filling prescriptions, and 62% took less medicine in order to save money. Food insecurity was particularly high amongst those experiencing disabilities. Here we show those numbers for hearing difficulties and vision difficulties, but it was also very high for those with mobility disabilities. This indicates that households may cut back on other basic needs, so they may cut back on the prescriptions, filling their prescriptions, in order to save money for food. Next slide, please. In addition to looking specifically at factors that were associated with food insecurity, such as race ethnicity, we inquired about the utilization of food bank services. And what we found was that transportation limitations, lack of knowledge, and feelings of shame or embarrassment prevented people from seeking out food assistance, even when they needed it. Amongst those who were experiencing household food insecurity, about 70% of them did not receive services that they may have needed because they didn't know where to get them. And 65% did not get free groceries because they did not feel comfortable doing so. These results are important when we start to think about interventions that we could put in place to help address food insecurity amongst those most at need. We can do a better job of assuring that there's transportation services for people who are food insecurity so that they can get to support services such as those provided by the Hawaiʻi Food Bank. We can also make sure people know where to go to get those services. And while not necessarily simple, we can put in place efforts to try to address the stigma and shame associated with getting free food when people need it. Next slide, please. And finally, the survey asked a number of questions about the experiences of those who were affected by the Maui wildfires. Of the respondents, just shy of 20% were affected to some extent by the Maui wildfires in 2023. We asked questions such as, did the respondent or their family lose a friend or family member? Did they have their wages reduced? Did they lose their job? Or were they housing relatives or friends because of the fires? Of those who were affected by the wildfires, 50%, just shy of 50% of their households were food insecure, as compared to 25% of those who were unaffected. Our numbers are strongly corroborated by a recent report that came out of the Economic Research Organization of the University of Hawaii. These results came out quite recently, and they showed that poverty had increased substantially amongst Maui residents affected by the fires, that they'd seen increases in their rent, that they were having to, that many of them had lost their jobs, and that many people have been displaced. So that ends my part of the presentation. I'm going to pass it on now to Amy.
Thanks so much, Catherine. Aloha, everybody. We were so grateful to have this opportunity to work together with Catherine and go through the study. And I'm going to pivot now a little bit to why we think we're seeing these numbers and a little bit about what we're seeing at Hawaii Food Bank. So inflation, this is really, I think, one of the core issues that we've seen and where we're concerned about why we're seeing numbers this high. These what you're seeing here, these data come from the Bureau of Labor Statistics, the CPI for food at home, so groceries. And since the start of the pandemic, we've actually seen an increase in these prices in Honolulu of more than 29%. And I'm sure all of you on this call have experienced some sticker shock at the grocery store yourself. But if we think about a family who's barely making ends meet, and we think a lot about our ALICE population, who might be loosely defined as one paycheck away from disaster, grocery prices going up almost 30%, that can be a disaster, right? A slow motion disaster. So your rent, your utilities, gas for your car, none of these costs went down. In fact, they might have gone up too, but your paycheck probably didn't keep up. So of all of the bills that households have, your grocery bill might be the only one that seems at all flexible. So what we're seeing, and this is what we see in those that were served, people often will pivot to less food, less expensive food, but they'll start to pull back on their grocery bills. So you can buy less, but you can't, only pay 80% of your rent. So this can be really enough. The cost of food can be enough to tip somebody who was food secure before the pandemic, but no longer able to make ends meet and starting to make some real compromises about the kinds of food that they're eating. And this is really what we're seeing in our distributions as well. People who are working 1, 2, sometimes 3 jobs, and they have always been able to make ends meet. Before COVID was food secure, but now needing to ask for help, and often for help for the very first time. And we're not even seeing many of these families don't necessarily need help every single month. So in fact, on average, most individuals who are accessing food bank and charitable food network services were only coming once or twice a year. So there's just a couple times throughout the year that they really need a little bit of help, but they're not able to make it completely on their own. I want to share this study, this case study with you guys also. This is just a snapshot of Oahu only, but average number of people that we served and pounds of food distributed just for 1 quarter of the year. So this is the first quarter of the year, January through March. We're kind of looking at the same time frame over the years. And you see 2019, prior to the pandemic, we were serving about 81,000 people on average per month, distributed 2.8 million pounds of food. And that was pretty that was pretty steady, especially in terms of the number, the pounds of food distributed. That was going back for years and years, for a decade or more. Food Bank was pretty regularly distributing 10 to 12 million pounds of food a year on this island. COVID hits, and obviously the numbers skyrocket. 2021, we were serving 156,000 people and almost 5 million pounds of food distributed. Then the numbers really started to tick down. We saw demand decrease. Many of our agencies are reporting, hey, we're going to have less families next week. You can bring less food. And then just started ticking back up again. And actually, between 2023 and 2024, we saw an increase of 28% in terms of our service numbers. Right now, we are serving almost as many people as we did during the height of the pandemic, and distributing almost as much food. So this is obviously really concerning for us, and the numbers continue to rise. I want to talk a little bit about some of the implications of food insecurity beyond kind of the obvious, and Catherine touched on some of this in our study as well. And food insecurity is more than just access to food, but it's really a health problem, and it's a community health problem. If you recall, we have people, the majority people who are food insecure, rating themselves as in poor or very poor health, and skipping medications, not going to the doctor in order to save money for food. So that makes a lot of sense, right? If you're not going to the doctor, you're consuming less healthy food items, that we start to see the prevalence of these pretty significant chronic diseases. In fact, there's 10 chronic diseases that are highly correlated with food insecurity: kidney disease, heart disease, lung disease, cancer, stroke, that also can be quite costly for folks to live with. We also see higher rates of mental health issues, sleep disorders, depression, anxiety. So a lot of very significant health issues amongst folks who are food insecure. And adults in households with very low food security are actually 40% more likely to have a chronic illness than adults in households with high food security. So this is a major health issue beyond food. It's also an education problem. So we think about 29% of our households with keiki have children who are food insecure. This is really hard. Young children cannot learn as fast, as well, or as much as their food secure peers. And even intermittent food insecurity can fundamentally change structure of their brains. So kids are not learning as much. They don't do as well in school, lower academic achievements, and we see more social and behavioral problems among kids because they don't feel well. They don't have energy for social interactions and can't adapt as effectively to environmental stressors. So we're really seeing issues in the education system as well. And it makes sense, right? If you're hungry, you probably can't learn, but there are well-documented relationship between academic achievement and levels of food insecurity. This is a workforce problem as well. Food insecurity negatively impacts economic potential. Workers who experience food insecurity as kids are not as well prepared physically, emotionally, or mentally to perform effectively in the workforce today. If you're food insecure as a child, the workforce pool, because of the reductions in academic achievement, we have a less competitive pool, lowers levels of education, and seriously constrained human capital. And even amongst families where the children today are food insecure, we're seeing impacts on their parents, right? So greater absenteeism, more turnover in the work environment. Folks might be present, but can't really engage because of the stress associated with their kids being hungry. And I just wanted to share this last study. And we think about, again, the high cost, the high cost of healthcare, and all of these chronic conditions and health conditions that are related to being food insecure. So this is a study that was done in 2017 on 2013 data that looked at this nationwide, looked at the costs of healthcare associated with food insecurity, and found that for every food insecure person, it's associated with an additional $1,800 a year in healthcare costs annually. So for Hawaii, if you translate that at a 30% rate of food insecurity, that's $800 million that we are paying per year in added healthcare costs because of food insecurity. And again, those are in 2013 dollars. So it's over $1 billion in today's dollars. Food insecurity is a really complicated issue, and it doesn't stand on its own. It's very deeply connected to all kinds of other issues that we face around housing and affordability and structural racism. I mean, there's lots of areas that you can't fix food insecurity by itself. And it's something that we really need to do together. So part of the reason we did this study and wanted to share it with the community is to really start a conversation about how the public and the private sector, how the nonprofit can, what we can do in the charitable sector. We can't continue to do this on our own. And that's, I think, one of our big messages is not something that the charitable sector can solve on our own, but looking to community, looking to government. So happy to have Jason and Alex with us here today to think about what we might be able to do in partnership to make sure that everybody on this island has access to safe and healthy food. Just quickly, I do want to touch a little bit on Hawaii Food Bank and what we do. We directly serve the islands of Oahu and Kauai, and we partner with the Maui Food Bank to serve Maui County and the Food Basket to serve Hawaii Islands. We don't do a lot of direct distribution. So we work with a network, about 225 partner agencies who actually do on the ground distributions. Right now we're serving about 160,000 people per month. Last fiscal year, we distributed food for more than 17 million meals, and 28% of that was fresh produce. So we're really focusing on trying to get more healthy foods out, because we know, for instance, that produce tends to be one of the first things that falls off people's shopping list because it's expensive and doesn't keep. So this is what we kind of look like, your network of food banks across the state. Our partners, we have about 40 partners on Kauai, 226 on Oahu, 139 partners, the Maui Food Bank serving Maui and Molokai and Lanai, and Food Basket, 88 partners across Hawaii Islands. And in addition to regular distributions at pantries, soup kitchens, we also collectively run mobile distributions across more than 300 a quarter across the state. And altogether, last year we distributed food for almost 28 million meals. I'm going to just touch quickly on some of the Hawaii Food Bank's programs, and Maui Food Bank and the Food Basket have similar programs, but we do have programs that focus specifically on our keiki. So in addition to getting food out through our network of partner agencies, and these can range from a small church pantry to a large nonprofit, we do have some specific programs targeting our keiki. We have a school pantry program. Right now we're in 50 schools. We're hoping to get to 60 this year, where kids can get access to a healthy snack during the day and usually can take home food for the weekends. We run a variety of meal programs during the summertime, both hot meals through our Feeding Our Future, and then food distribution programs for about 2,500 kids through Cow for Keiki, where they can take food home for the week. And we've just launched this new program called Child and Adult Care Program. This is an underutilized USDA nutrition program that we're able to do in partnership with the After School All-Stars, where kids can get access to after school meals. So we've launched that in 7 schools now. We also have kupuna programs. We have a food box program, serves about 2,200 kupuna every month. And at most of those distributions, the families, the seniors also get a bag of produce. And we also have a senior farmers market nutrition program. This is another USDA program for qualified seniors. We're serving about 7,300 right now. The seniors will get vouchers that they can use to pay for food at farmers market. So that's a really popular program too. And I mentioned this earlier, nutrition is really important to us. We want to be the healthy option, and we've really focused on providing more healthy choices, more produce. And another thing that we're doing right now, you see this, choose red, yellow, and green. It's called the HER Healthy Eating Research. We're working to get a color on every single food item that we distribute. So yellow, red is choose rarely. These might be sugar, high fat items. Yellow, choose sometimes. This might be refined grains like white rice or bread. And then choose often healthy proteins, healthy produce. And our focus is to concentrate as much of the food that we distribute as possible in that green category. We also have a farm to food bank program that was started in partnership with the Hawaii Farm Bureau and with a lot of support from OER, the City and County of Honolulu, where we were able, right in the beginning of the pandemic, we're able to partner with the Hawaii Farm Bureau and purchase food directly from our local farmers, because many of their regular customers obviously were not open, and we've continued to invest here. We've invested over 10, in fact, I think the number is now $11 million in Hawaii grown food, supported more than 40 farms and food hubs, and distributed 8 million pounds of food, including culturally important foods like poi and ulu and uala. Right now, we're still purchasing about 30,000 pounds of local produce every week. And the last element that I might, that I'll just share, because we do this in partnership with the City and County of Honolulu, also is disaster response. So we think of food insecurity and hunger as really an everyday emergency, right? For somebody who is having trouble accessing safe and healthy food, that can be today, because of a lack of funding or lack of access. But obviously, when there are major disasters, that can increase the number of folks who have trouble accessing food. So we work collaboratively with Department of Emergency Management here in Honolulu, and also with Kima on Kauai to be the partner and lead responder for food mass feeding in times of disaster. And that is all I have. Thank you so much. And I'm going to turn it over to Jason and Alex.
Thanks.
Mahalo, guys. Kalamai, I just had a couple of questions I wanted to follow up, and just mahalo, Catherine and Amy, for such great presentations. And just had a question for, I think, kind of for both Amy and Catherine. We had a guest on our last event discussing the food as medicine, and I was just wondering if that is something that's going to be connective to like Hawaii Food Bank. And then with that, do you think, Catherine, like with what you noticed and sort of the stigma and the shame, that would be something that might sort of kind of make that easier for people to be comfortable picking up food if it's prescribed as medicine, perhaps, or something like that?
Well, I can take that first half of the question, which is we're really excited about the potential of the Medicaid 1115 waiver, and we've seen in other states how it's been really quite impactful on food insecure populations in terms of providing funds to get safe and healthy food. Excuse me, healthy food to food insecure populations. So we are really excited about the potential. We hope to play a part in it. Again, we, in addition to procuring more healthy food items, we also are working around nutrition and nutrition education too, because it's one thing to get healthy food or produce, but a lot of folks haven't, learned how to cook with it and don't know how to use it. So we're also including recipes, and we hope in the future to do more cooking demonstrations so that people can access food that they may not be regularly familiar with building into their diets. Catherine?
Yeah, I have a number of thoughts on this. I would say, like, specifically, you're asking about, whether you could prescribe food to folks. And I strongly agree that food is medicine. I think it's central to so much of, what we think about, do during the day, our culture, etc. I will say that there have been public health or health promotion interventions put in place elsewhere in which doctors prescribe, they literally make a prescription to eat better or to exercise. The challenge I find with that is it's very hard to tell somebody to say eat better if the resources are not out there for them or if they can't afford them. So I do think that when we start to think about our messaging around eating healthy or eating correctly, there needs to be a lot more sensitivity to what people actually can or cannot do. And so, addressing some of that, the issues around shame and embarrassment, I do think your point is well taken about reframing it more in terms of, instead of it being charity, about taking care of yourself, taking care of your whole body, which includes, in many cases, the spiritual elements that are associated with food, the cultural connectedness that's associated with food. But I do want to return to Amy's point at the end of her presentation of saying that the onus on this cannot just be on the charitable food network, that we really do have to understand that from my perspective, it is egregious that our food insecurity levels are this high. This suggests that we need to do something across our entire state to start to address the problem. And this starts from the very top on down, and it cannot just be addressed by the charitable food network.
Very good points. Thank you so much, both of you. Great presentations. Yeah, so now let's turn it over to Jason and Alex.
Sorry, I lost my screen there for a second. Can you see my slides?
Yep, we got your slides
Okay.
and we see you. Mahalo.
Awesome. Well, mahalo nui for inviting us to participate in this series. I personally try to watch everyone, and so I'm honored that I get to speak on one as well as with Jason. We're going to be talking about our roles in the city and county of Honolulu. I work for the Office of Economic Revitalization as the Sustainable Agriculture and Food Systems Program Manager. And Jason, who will introduce himself in the second half of this presentation, is the Food Security and Sustainability Program Manager. While we work in different offices, Jason and I try to work as collaboratively as possible. And so you'll often see us in the same spaces, but we do work in different offices, which I think is worth noting. I'm going to talk first about myself and about OER. Again, my name is Alex Narrajos-Corby, recently added a last name to that list of names. I'm originally from Chicago, moved to Hawaii in 2017 to do AmeriCorps for HackBed, and then worked for a number of different environmentally focused nonprofits, including Keiki and Plow, which is a small farm in Hawaii Kai, Kokua Hawaii Foundation on the North Shore of Oahu. And then during the pandemic, began working with Chef Hui, which spurred my interest and attention to disaster preparedness and disaster feeding and how organizations work during crises, which led me to go back to school. And I just graduated with my master's in urban and regional planning at Manoa with a focus on food systems, and started working for the City and County of Honolulu's Office of Economic Revitalization in March of this year. A little bit about OER. OER started out of the pandemic, so we're the youngest office in the City and County of Honolulu, and it started as a place to house the rental and utility relief program, as well as other CARES money programs focused on economic revitalization. And today we have a number of different programs as listed on the screen, which includes regenerative tourism, rent and utility relief, broadband and digital equity, Pacific Islander resources. We have the Oahu Business Connectors, and I forgot to put it here, but we also have a workforce development program. And then also we have a sustainable agriculture and food systems program, of which I'm the program manager. This position was originally held by Dexter Kishida, who's now the deputy director of the Hawaii Department of Agriculture. And so he set a really strong foundation of the sort of work that we get to do in these roles, as well as the relationships that he and his team built. It's worth noting the programs that he started and that Jason and I are sort of tasked with wrapping up, which includes the Ag Grants Level 1, which we were able to distribute 67 grants to small farmers who were negatively impacted by the pandemic, as well as supporting the food bank, as Amy mentioned, and distributing CARES money to farmers and food producers and food systems players. My work in this position focuses on 4 pillars, which are evolving every day, I feel, but I try to focus on good jobs, Pono ag economics, food security, and food systems Pilina through a number of different efforts. For good jobs, we are supporting technical assistance providers and participating in some federal funding training to hopefully get some larger federal funds that can go towards workforce development, ag tech, those sorts of things. Pono Ag Economics, that's through the Oahu Good Food Show, which was another program that Dexter and his team started, and that is sort of on hiatus now as we rethink how to best support institutional purchasing efforts across the county and the state. Also strategic planning with other city agencies. People's Open Market is a program that the city hosts that is focused on getting local food to low income purchasers. So trying to support that program. Food security, working within disaster feeding efforts, and then also being on the steering committee for the Hawaiʻi Food System Summit, which will be this year, December 9th through the 11th. At UH West Oahu. I believe those details are set. There's more information on the website. And this theme for this summit is focused on zero hunger, which was spurred by this report that Amy and Catherine talked about, which was sort of shocking and eye-opening to a lot of people. And so honing in on that energy to focus towards how to relieve some of the stats that were just shared. And then food systems Pilina, through a quarterly newsletter that we're going to start releasing through the office, and then participation in multiple working groups and huis, as well as maintaining and creating partnerships. And so my current role, goals in this role are to understand the city's role. We're in a really unique position to continue, but also like start defining the city and county's positionality within food systems. And how we can be best supportive to the community organizations doing the work and who understand their communities the best. How to align and enhance work being done in the community with county and state goals, and how to funnel federal funds to these organizations. And so that's currently what I'm sort of working on. But if anyone has any project ideas or want to chat or collaborate, please shoot me an email. My email is alex.narrajos@honolulu.gov, and I will pass it to Jason.
Thank you, Alex. Thank you, Alex. And I also wanted to say thank you to Amy and Catherine, not only for the amazing work that they do, but also for establishing what I consider to be a new gold standard for measuring food security in Hawaii. And also calling attention to the true need in our community. It really adds to the urgency of the work that Alex and I get to do. So aloha again, everybody. My name is Jason Shon. I work for the City and County of Honolulu's Office of Climate Change, Sustainability, and Resiliency. We call ourselves the Resilience Office for short. Our programs, we have roughly 6 different areas. I lead the Food Security and Sustainability program. I also obviously work closely with Alex in the Office of Economic Revitalization. But I wanted to use this opportunity to talk about one project in particular that I'm working on, and that is the development of a food systems plan for the city. Next slide, please. So currently, Oahu does not have a food systems plan. We have an economic development strategy, we have a climate adaptation strategy, we have a resilience strategy, we have a lot of different plans, and many of them touch on different topics related to the food system. But we don't have one document that brings all those ideas together in a coherent food system strategy. And when I say food systems, I mean it in a very broad sense. So that includes all the activities along the supply chain from farm to fork and beyond, the drivers of those activities and the outcomes they produce, the people involved, and all the interconnections. So my goal is to develop a food systems plan that articulates a clear vision and actionable strategy for the city to enhance food security, which, as we just heard, is such a critical issue in our communities. And of course, the plan will also bring us closer to our other food systems goals. Next slide, please. So I think a city food systems plan hopefully will help to accomplish these overarching objectives. As I mentioned, it would establish a unified food agenda for the city by bringing all food-related strategies under one coordinated framework. So you don't have to read 30 plans to understand what the city is doing in food systems. It would identify specific actionable steps and investments that the city can do. It would enhance communication and coordination among city agencies and with external stakeholders. So a lot of our work in our office right now already around climate already cuts across departments, and food is no exception. So we need that enhanced capacity to coordinate across silos. I think the plan should promote a shared understanding of the food system, its goals and key metrics. My hope is that it would increase transparency and build trust with stakeholders and the public, as well as support grant applications and funding opportunities, and show how local food system efforts are aligned with broader sustainability goals like the Aloha Plus Challenge and the United Nations Sustainable Development Goals. Next slide, please. I also think it's important that the plan reflects these kind of characteristics. One, that it's community-based, so the priorities are shaped by the needs and input of local residents, organizations, and stakeholders. It's values-driven and grounded in science so that we reflect community priorities and are getting effective and sustainable outcomes. It'll be city focused. So again, we're focusing on the role of the city and county of Honolulu and not, for example, what the charitable sector should or is doing, or what the private sector is or should be doing. Certainly partnering with those sectors is an important part of what the city's role could be, but this is a city plan designed for that seeks to articulate city actions. It will be integrated, meaning efforts are coordinated across city agencies. It won't just be the Office of Climate Change, for example. And it'll be comprehensive. So it'll adopt a food systems approach that looks at the system as a whole and not just one particular dimension. Next slide, please. So I wanted to give you a kind of a sneak peek at the overarching framework of the plan. You'll notice there are 5 dimensions, and each dimension is associated with a guiding value. So we have secure and healthy people at the top, malama pono, and that's where we'll be focusing on food and nutrition and security. There's healthy ecosystems, malama aina, vibrant local economies, ho'ovaivai, empowered communities, ea, and resilient oahu, olaloa, which is kind of long-term resilience. And under each of these dimensions, there will be more specific strategies and then concrete actions. And as I mentioned, we want those actions to be informed by the community. But we also recognize that residents are always asked by government agencies to participate in workshops and provide feedback, and that can be exhausting. So to prevent kind of overwhelming the community and avoid kind of an extractive process, we've chosen to take a hybrid approach that includes some public outreach, targeted meetings and discussions with key food systems actors and organizations, and a thorough review of existing city plans, academic literature, and food plans from across the US and abroad. And I think it's often easier to provide actionable and concrete feedback if you have something to work off of rather than a blank slate. So right now we're working on just getting a draft done based on the information and input we already have. And once we have that first draft, then we can begin the important process of iterating and honing the ideas. And so there will be multiple opportunities for everyone to provide feedback. And that's where we'll need everybody's help. Next slide, please. So in the next few months, I'm hoping we'll finish a draft of the plan and then begin asking for feedback. So my ask right now is that if you're interested, please subscribe to our newsletter or follow us on social media so you know when those opportunities arise. And that's it for me. So mahalo for this opportunity, and I'll pass it back to Ioane.
Mahalo nui, Jason. Mahalo, Alex. Really great overviews of what you guys are doing over there in the city and county. Just had a couple of questions I wanted to pose. I'll pose to Jason and Alex first, but just some broad questions, with the work that we're doing and a lot of the emphasis everyone's putting on the way that we interact, the way that we build, build up just an acknowledgement of food systems in general for the public and how this is sort of new language in a lot of ways. What can we do at the university level, at the Kale Mal Center, to help strengthen and support your work through either research, education, policy analysis, things like that? Could you offer any insight into how we could help you out better in that department?
I guess for me, the most immediate ask would be to, when we have a draft of the plan, to help get the word out and to help us connect with key stakeholders in the community, so we can get concrete feedback on the actions that the city can do. I think more long term, it'll be the kind of research and collaborative partnerships that the center could provide, could offer with the city, I think will be extremely valuable going forward. And I think we would rely on the kind of work that the center does, particularly around gathering data and providing those kinds of recommendations going forward. Alex, did you want to add anything? Or?
I think what you said is perfect, Jason. I also wanted to add that in this, me being new to this role and new to the city and working with the folks like higher up that make decisions and sign off on things, just defining terms has been an exercise for me of how do we take these, academic terms or more field specific terms and make it so our city council understands and our mayor's team understands. And so I think I often look to the Transforming Hawaii's Food Systems Together website just to make sure I'm using the right words. So continuing to sort of hone in on those definitions and understanding what they mean in different communities and in different projects, I think is something that I'll continue to look for.
Mahalo. Yeah, and just to reiterate, we have our food system summit coming up, and I think those are fantastic opportunities for all these things to kind of go across the board and unify everybody on language and intention and make these more common ideas within our community and in food systems work. Amy or Catherine, do you have any insight for that?
Yeah, I mean, I would say I think we're really grateful to be focusing the Food System Summit this year on this idea of zero hunger and just really elevating the research and, frankly, it's really not okay, right? That we live in one of the richest countries in the world, and we're sitting here in this like very amazing place that once supported, maybe 1 million people on resources that were grown or caught here. And now we import 85 to 90% of our food, and 30% of our population is food insecure. To me, it's unacceptable. And so whatever we can do to either educate folks, right, and make sure that there's the awareness there, but also, maybe fight a little bit against this complacency, like, well, it is what it is and it's okay. And it's not okay. And even within the university, almost half of our young people and folks enrolled in higher ed are food insecure. Like, that's just not okay, right? So I think there's also things that we can do within our own community, within the university, to say like, okay, we have our own students, half of our students are food insecure. How can we better support them? Like, this is affecting all of us. So leveraging those communities and the university community to start to nibble away at the problem, I think would be something.
Very good point. Mahalo.
I just want to, I mean, I think Amy's point, especially with if you're asking specifically about the university, is that, you know, we have to start at home. If you're going to be asking about the university itself, with that many people who are food insecure, then there needs, within the institutions themselves, then there needs to be a focus on what's happening there. I think the response has largely been, okay, we'll just provide more free groceries, more food bank type services at the university, and that's clearly not addressing the underlying problem. And so we've, you know, I think what I want to, you know, say thank you to you for and you folks for is this idea, this understanding that this is a system-wide issue. And that if we're going to be addressing, if we want to improve food security, if we want to ensure that we have sustainable food systems, if we want to have just food systems, then we have to look at the systemic issues that either support the goals or contribute to, you know, that serve as barriers to them. So, you know, that's addressing income inequalities, it's addressing housing issues, but it's also addressing, you know, the issues our panelists here we're also bringing up around climate change, sustainability, disaster readiness. And so I think that all of that needs to be brought into the fore, and I think we have to do a much better job of looking at these things together and not separately. And again, just a big mahalo to you guys for acknowledging that and trying to provide that space.
Mahalo. Yeah, I think that's really the theme. Yeah, is like you know, oftentimes people think of food systems, they key in on that language of it's food, so they think it's agriculture, but it's just this, you know, it's this transdisciplinary range of all these different things that contribute to our food systems. You know, even if they don't seem connected in some way, most things are connected to our food system like that. So you know, and that's why I very much appreciate you all and value the work that you're doing and taking the time to come here and share in this format and, you know, build these relationships. And, you know, there's really no borders or difference in what we're all trying to do here. It's just different aspects of it. So it means a lot. We really appreciate it. And I think, yeah, we're pretty much wrapping up on time. Is there anything, does anybody have any final thoughts they want to share or anything else? All right. Well, again, I just want to thank everybody. If there's any follow-up questions, we didn't have any Q&A stuff populating in the webinar today, but I put a lot of different contact information and links. Anyone who wants to reach out after the fact, we're going to generate this to our YouTube, you know, our YouTube page, and I'll send out the link to everybody who registered as well as our panelists. And please contact us at kiomau@hawaii.edu. Check out Transforming Hawaii's Food System Together and all of these respective links and things to these reports and websites. And just want to thank everybody again and wish you a beautiful day. Mahalo.